Have you ever held back from sharing something important, even with someone you trust, because a deep sense of shame made your throat tighten and your words catch? It is a very common human experience, especially when dealing with personal struggles. Talking about feeling ashamed in therapy starts by simply acknowledging that feeling to your therapist. You do not need to articulate the full story immediately or perfectly. Just naming the emotion, even if it is uncomfortable, opens the door for your therapist to support you in exploring it safely. The core reason this approach works is that therapists are trained professionals who understand the powerful role shame plays in many mental health challenges, especially eating disorders. They know that shame thrives in secrecy and that bringing it into the light, even in small ways, is the first step towards reducing its power. Your therapist will create a non-judgmental space, knowing that this emotion is often a protective mechanism, not a sign of weakness. To begin, you might say something like, "I have something I want to talk about, but I feel very ashamed." Or, "There's a part of my story that is hard for me to share because of how much shame I feel." You can also write down what you want to say beforehand or even show your therapist a note. Remember, your therapist is not there to judge you, but to help you navigate these difficult emotions, providing a supportive mirror rather than a critical eye. An interesting fact about shame is its distinct difference from guilt. Guilt is about feeling bad for something you did, while shame is about feeling bad about who you are. Understanding this subtle but crucial distinction can help you and your therapist tailor strategies specifically to dismantle the belief that you are inherently flawed, which is often at the root of much emotional distress. Ultimately, speaking your shame aloud in therapy is an act of incredible courage, and it is a vital step in your healing journey. By sharing these vulnerable feelings, you begin to transform them into understanding and self-compassion, paving the way for true freedom and recovery.